Hello, I'm Laura Bachrach, one of the attendings in Endocrine Clinic, and this tape is designed to orient you a little bit to the approach in the endocrine clinics and hopefully make your experience there a better learning experience. My remarks are designed primarily for medical students, rotating through just for a couple of days, but they apply as well to residents. First of all, the endocrine patients that we're going to have you see hopefully will be mostly new consultations. These are patients sent in from the community, and any information that we have on the patient will likely be found on Cerner under scanned documents, and we can help you find those documents when you arrive in clinic. We encourage you to take a look at the scanned documents before you go into the room. Please don't spend too much more time at the computer because patients are waiting. Once you've seen the documents, please go into the room and ask the families their understanding of why they're there. Please ask them to provide the history. Do this as completely as if this were an admission to hospital. Go through their understanding of the problems, their level of concern, and you can review any information you have from the referring physician. In terms of the history, you want to get their impression of the history of present illness incomplete. Past medical history, there are some specifics that are important to always gather from these patients. Always important to gather the pregnancy history, the birth weight and length, as these may impact later growth and development patterns. Please also, of course, ask about surgeries, hospitalizations, fractures, etc. In terms of family history, the endocrine-specific elements that we like to hear about are the heights of the parents. Please inquire about that as best they know them. Please also ask about the timing of maturity in the parents. For women, that's typically their age of first menstrual cycle, and for the father of the child, it's typically, were they an early or late grower? Did they still grow after high school? Most men are done growing by 17. So somebody done growing in 8th grade, or somebody done growing, continuing to grow past high school, maybe an early or late bloomer, respectively. We, of course, are interested in the endocrine diseases in the family. Please specifically ask about thyroid disease, diabetes, inquire whether it's type 1 or type 2, find out about other autoimmune diseases such as celiac disease, rheumatoid arthritis, etc. In terms of social history, how is the particular problem the child is presenting with impacting the child? And then systems review, we do focus on the usual, but also specifically ask about headaches, visual problems, polyuria, polydipsia, weight loss, weight gain, onset or signs of puberty, behavior changes, etc. And then we do a complete physical exam. It's really important to make an attempt to look at all parts of the body, including the Tanner stages. And we know that's uncomfortable for you. We'd like you to take a stab at that, remembering that Tanner stage 1 is a prepubertal child, Tanner stage 5 fully mature, and we can help review the other stages of puberty with you in clinic. In terms of presentations to the attending, please come out of the room having written down all your notes on the piece of paper. Scribbles are fine. Come out and present to one of the attendings. We'd like to hear you present the whole history, past medical history, family history, etc. In terms of presenting the exam, please give us a one-liner about the general impression of the child. This is a 4-year-old anxious child. This is a 10-year-old who looks in no acute distress, etc. Then please present the height, weight, and body mass index plus percentiles. This is really important to us. So don't just tell us they're 149 centimeters tall. Tell us what percentile that is. We also want to hear the blood pressure and the heart rate. In terms of detailed systems, you can give us pertinent positives and negatives if you feel comfortable with that. At the end of your presentation of the history and physical, please take an attempt at an assessment. So in summary, this is a 10-year-old with concerns of growth delay, or this is a 8-year-old with concerns for precocious puberty, and then take an attempt at what might be the causes of these things. Again, it's helpful for us just to see you make an attempt. We know that you aren't a subspecialist. This is our job to teach you, but please make an effort to come up with a proposal as to what might be going on and how we might investigate. We hope that endocrine will be a good learning experience for you. We'd rather you try and make mistakes than not make any attempts at all. And I'm hoping this introduction will make those first few visits go easier. Thanks so much. Look forward to seeing you.